Well, welcome back. New data shows that Americans are struggling to pay rent during this pandemic. The National Multifamily Housing Council found nearly a third of 13.4 million U.S. renters did not pay their rent between April 1st and the 5th. Right now, an order from Governor Holcomb prevents evictions until May the 5th. There is a concern for a group of people who are not covered by that order, those who are living in extended stay hotels or motels. The CBS 4 Problem Solvers heard about this concern, and our Jill Glavin went to housing experts to find out more.
We have heard from some people living in hotels or motels who are worried about eviction, and housing attorneys tell me those families are at an even greater risk right now.
Sadly, also, many of them were folks who were just getting on their feet.
Brandon Beeler and his team at Indiana Legal Services have been working since the pandemic began to help vulnerable Hoosiers keep their homes. And that includes those living in places like extended stay hotels.
Residents of hotels don't have protected property interest in their hotel rooms, meaning that they can be removed without due process, or in other words, they can be removed without having to go to court.
We're going to try to resolve it.
So the governor's temporary halt on evictions doesn't apply.
However,
though Beeler notes that in Indiana's stay-at-home order, quote, the term homes and residences include hotels and motels. That could present a legal argument against people being removed from their hotel rooms.
we think, against the spirit of the executive order to put anyone out on the street at this, during a global pandemic.
We certainly have a long way to go.
Amy Nelson, who runs the Fair Housing Center of Central Indiana, agreed, saying there is growing concern among housing advocates about what will happen after the governor's orders are lifted.
What COVID has certainly raised is the instability there when individuals are not protected because it's technically not viewed as the same sort of lease arrangement as it is with traditional rentals.
Indiana has not absolved anyone of their rent, so like those in apartments, people living in hotels will have to find a way to pay, leaving Beeler searching for assistance for his clients to keep a roof over their heads.
Frankly, a lot of community groups are really stepping up, and churches and places of worship are having funds to help folks. So we're sending a lot of folks around to just kind of keep their eyes and ears out for who may be offering rental assistance at this time.
If you need help with emergency housing or paying rent, you can call 211 right now. We also put a link to more resources at this story. It's on our website and mobile app under the Problem Solvers tab. For CBS 4 Problem Solvers, I'm Jill Glavin.
Another myth is making the rounds that coffee filters can be used as masks to protect yourself from COVID-19. They don't. Coffee filters, like all paper products, attract moisture, something to avoid while protecting yourself. The CDC says a filter or other paper products bring droplets closer to your mouth, defeating the whole purpose of that covering. The CDC recommends several layers of cloth or other material when making a mask. The Indiana State Department of Public Health reports you can put the masks in with your normal laundry.
All right. Well, as Governor Holcomb extends Indiana's stay-at-home order, some say that cabin fever is kicking in. Our Kayla Sullivan talked to a local expert about what you can do if you're getting a little stir-crazy.
For some, the thought of an extended stay-at-home order is daunting. You may experience symptoms of cabin fever as a result.
Increased irritability, things that maybe wouldn't be as bothersome are more bothersome now.
IU Health Professor of Psychology Danielle Henderson says cabin fever is normal, but it's important to know what to look out for. You could feel sad, depressed, start eating too much or too little.
Changes in your sleep, maybe difficulty going to sleep or having a restless sleep or having difficulty waking up when it's time to get up.
When I explained symptoms of cabin fever to 5-year-old Melanie Brinchley, she could relate.
Last week that was me.
That was you last week? Well, talk a little bit about how it made you feel. Like, what were you saying? What were you doing?
I hate being stuck inside.
Henderson says kids are probably feeling the same way you are, so check up on them and validate their feelings.
Yes, I understand that you're sad that you can't see your friends at school or you can't see grandparents. I'm sad too, or I'm upset too, but we have to do our best to stay at home.
She says for both families and individuals, keeping a schedule is key, and so is moving your body.
How can we still be active? Yes, it's going to look different than what it did maybe before COVID, but there's still ways to get in good exercise. You can do things in the house, or if you feel comfortable going outside.
If you aren't comfortable with going outside yet, you're still very much encouraged to let the light in.
Those things can really help regulate our mood, or sitting by the window, sitting on the back porch or front porch. Those seemingly small things can still be very beneficial.
For little Melanie, she prefers music therapy.
We have a dance party.
Kayla Sullivan, CBS 4 News.
Grocery store employees say too many shoppers are ignoring COVID-19 safety guidelines. In a recent survey of grocery store employees, 85% say shoppers are not sticking to social distancing guidelines in the stores. A spokesperson with the United Food and Commercial Workers Union says it's crucial for shoppers to follow the rules to protect themselves and the employees. Plexiglass shields, space markers, and one-way arrows in aisles are only helpful if shoppers follow the guidelines.
So if people stay 2 carts apart, that's generally a good guideline. Our members really appreciate when folks wear masks in stores.
The union is still pushing to have grocery store employees designated as extended first responders to get them better access to personal protective equipment. People with food allergies face unique and dangerous challenges during this pandemic. Now, a group dedicated to food allergy research and education has suggestions to help those with allergies navigate through food shortages. Alexandra Lehman has more.
Shortages at the grocery store are forcing Americans to get creative with their meals, but those who suffer from food allergies don't have the same flexibility. Lisa Gable is CEO of the group FAIR, Food Allergy Research and Education.
The food allergy families already have a level of anxiety. It's never an easy process.
Grocery delivery services are popular as people practice social distancing to slow the spread of the coronavirus. But sometimes those services substitute items, creating danger. But there are ways people can help each other.
When people are in the grocery store and they're making choices, and if they don't, for example, have a dairy allergy, we're hoping that they'll leave things like those optional soy milks or almond milk.
FAIR says people can ask a manager at a store or food bank if they can hold items that are safe for them. An allergic reaction often means a trip to the emergency room. But with COVID-19 adding new risks, Tuesday, Dr. Tom Casale, FAIR's chief medical advisor, issued new recommendations to help avoid an ER visit.
Inject epinephrine, then call for help from a neighbor or someone else, where you could be by the front door, unlock it, so that if you did have a severe reaction, someone else could still activate the emergency medical system.
Casale says people should speak to their doctor before trying this. In Washington, Alexandra Limon.
Still ahead, Hoosiers are rising to the occasion to help neighbors who are in need. We're looking back at some of the most moving examples of Hoosiers and hospitality from this past week.